Hello friends, today I will discuss some simple lifestyle modification tips that can help in lowering blood pressure. As you know, normal blood pressure is below 120 by 80 and any blood pressure above 140 by 90 usually needs medications. So if you are in the range of say 120 to 140 systolic or 80 to 89 diastolic, you could try lifestyle modifications and then see whether blood pressure is getting lowered or not. So in this, the first is diet, and the diet most studied is called DASH diet, dietary approaches to stop hypertension. In that, there is increased intake of fruits, vegetables, low fat dairy and whole grains. At the same time, there is lower intake of saturated fats, red meat and added sugars. So this can definitely help in lowering the blood pressure. Second is weight loss. So every kg of weight lost can result in lowering of systolic and diastolic blood pressure by about 1 milliliter of mercury. So if someone who's overweight or obese can lose 5 kgs weight, it can help in lowering blood pressure by 5 millimeters of mercury. The third is exercises. In exercises, all kinds of exercises are known to lower blood pressure, including walking, running, strength training. But in one of the good studies, what was shown is that isometric exercises such as planks or wall sit, they were the most effective in lowering the blood pressure. The third is lowering the fourth one is lowering the stress. We all know stress can raise the blood pressure, and if you can reduce stress, the BP also can be lowered. And then the fifth one is sodium intake. Now sodium or salt, excessive intake definitely increases the blood pressure. So as per the WHO, the recommended sodium intake is 2300 milligrams per day in a day, and that comes to about 1 teaspoon of salt, that is about 5 grams of salt per day. And those who have high blood pressure, or for some people the sodium intake can be further lowered to 1500 milligrams per day. But caution here is that sodium is important, salt is important. You should not totally do away with the salt. So don't stop consuming salt, but the limits, as I mentioned, they are fine. And then the last few things, one is abstain from alcohol. So alcohol intakes, especially higher amounts of alcohol, can definitely raise the blood pressure, and abstaining can help in lowering blood pressure. Similarly, smoking also will raise the blood pressure, and as well as other risk factors like diabetes, and it can increase the risk of heart attack and strokes. So abstaining from smoking or quitting smoking will also go a good way. And the last one, and not the least important, is sleep. So optimum sleep duration is 7 to 9 hours. So both sleeping less or more can cause rise in blood pressure. So try to have an optimum sleep. So with these lifestyle modification, definitely